Hello there, I'm here to bring you news from Volition of a $28 million license and supply agreement which they've signed for their Nu-Q vet cancer test with the Heska Corporation based here in the United States. Earlier I was talking to Kevin Wilson, who is the President and CEO of Heska, and Dr. Tom Butera, who is CEO of Volition Veterinary.
We're absolutely delighted that we're signing an exclusive point of care agreement with Heska Corporation up to $28 million, with $10 million up front and another $18 million over time. And then the additional exciting third part of this deal is that we're going to get continual revenue and recurrent revenue from the selling of the test itself and all of the point of care units that are going to be put in the hospitals by Heska. This test is specifically, as I mentioned earlier, about point of care, which is something that would be readily accessible to veterinarians in all their veterinary hospitals. We are focused on initially on the Nu-Q cancer test, which is specifically designed for testing cancer in canines. We are also in the process of establishing a monitoring test for canines as well, which can be used to monitor disease as well as monitor remission from disease in the future. In addition to that, we are also going to be working with Heska on a feline cancer test coming out in the future. We also signed a non-exclusive agreement with Heska with reference to central laboratories. What I mean by central laboratories is reference labs. That's where the veterinarian takes the blood in their veterinary hospital and then sends it off to one of the Heska reference labs. But that is a non-exclusive agreement.
Heska is hundreds of people around the world. We have offices in the United States, Canada, Australia, Germany, France, Italy, Spain, and Malaysia. We're dedicated to pet healthcare, and primarily we're dedicated to diagnostics. We see this as a primary test on our Element I+. It's an immunoassay analyzer with fluorescence technology. And because it's at the point of care, we can deliver results in minutes instead of having to wait days. And so pet owners, conceivably with this test, will be able to come in for their annual wellness exam. And while they're getting screened for things like kidney function, heartworm, infectious diseases, it occurs to just about everybody with a pet at a certain age. Does my dog or cat have cancer? And the ability to screen for that is unbelievably important. So we would roll this out as soon as possible into each market that we operate. 1
out of every 4 dogs are diagnosed with cancer. In the United States alone, there are 77 million dogs. Over 6 million of them are diagnosed with cancer on an annual basis. 50% of the dogs that are over 10 years of age die of cancer. So you can see how this is a test that hopefully is going to save a lot of lives.
Volition has some of the top specialists in the world developing this test. So you have Sue Ettinger, you have Texas A&M, there's a whole team of specialists who have been involved in this project. And to be associated with that on a global exclusive basis, I think sends a signal that we trust the Volition team and the technology and the peer-reviewed papers, and that they trust Heska to bring it out on a global basis to as many pet owners as possible.
Our goal is really to be the leader in the cancer detection for the companion animal, and consequently having a partnership with Heska in point of care distribution, having access to the number of veterinarians that they can have both domestically and internationally, is a phenomenal exposure for us and a phenomenal partnership. In addition to that, the animal growth and the pet care growth on an annual basis is growing exponentially. So if you put those two thoughts together, you can see that the addressable market, the financial return, the early detection cancer return, and hopefully the treatment return all contribute substantially to the excitement surrounding this deal.
Once you've screened for cancer and you've identified it early, treatment begins. And when treatment begins, generally a board-certified oncologist is engaged with that, so it's a referral situation. But that pet eventually will come back to their primary caregiver, and the monitoring of that pet while they undergo treatment and also post-treatment as recovered patients, I think is super important as well. And so the cost and the speed of this test, the ability to get those answers immediately and the ability to do them regularly at a cost that pet families can afford, we think is critical. There's a market for very expensive genomic types of tests, but I think waiting days or weeks and spending thousands of dollars on them really doesn't fill the same need that we're trying to fill, which is early detection and regular monitoring post-treatment.
So great news from Volition and also the Heska Corporation, and watch out for further developments of this particular agreement in the future.